Our top priority continues to be the health and safety of all Canadians, and our commitment to work together with provinces and territories to keep Canadians safe remains unchanged. As the warmer weather arrives, we know that across the country, Canadians are looking forward to seeing friends and family and enjoying the outdoors. Notre gouvernement a mis en œuvre des mesures importantes afin de sécuriser nos frontières et assurer la sécurité des Canadiens. Ces mesures ont été efficaces, mais elles n'étaient jamais censées d'être permanentes. Aujourd'hui, nous pouvons annoncer des ajustements à nos mesures sanitaires parce que les Canadiens se sont mobilisés pour se protéger mutuellement et ont suivi les conseils de la santé publique. Mais nous devons nous assurer d'être prêts pour un retour potentiel du virus à l'automne et notre meilleure protection contre la COVID-19 demeure la vaccination. Si vous n'avez pas encore reçu votre première dose de vaccin ou votre dose de rappel, je vous encourage fortement à aller les chercher. Today's announcement is possible because Canadians have stepped up to protect each other. We are now able to adjust our policy because we have followed consistently the best advice from public health authorities. But we need to make sure we are ready for the fall, and our best protection against COVID-19 is being properly vaccinated. If you haven't gotten your vaccines or your booster yet, I encourage you to do so. I know that Canadians may wonder, is this too fast or is this too slow? It has been very tough for Canadians these past 2 years. Our job as a national government has always been to keep Canadians safe. If the situation takes a turn for the worse, we are prepared to bring back the policies necessary to protect Canadians. We don't regret at all being cautious when it comes to a virus that has tragically killed tens of thousands of Canadians and millions of people around the world. Acting prudently has saved lives, and we will always continue to be cautious. Nous ne regrettons pas du tout d'avoir agi prudemment devant un virus qui a tragiquement coûté la vie à des milliers de Canadiens. This announcement is not about shortening wait times that are currently being experienced at some of Canada's airports. As you know, these wait times are mainly caused by staffing shortages. The adjustments we're making today are based on science, and they will not have an impact immediately on these airport delays. We remain committed to reducing the wait times at Canada's airport. We have already taken a number of steps to improve this situation, and my colleague, the Transport Minister, will have more to say in the coming moments. Thanks to Canadians, we are able to make today's announcement. And to share what precise next steps are to come, I'd like to invite my colleague, the Minister of Transport, to say a few words. Omar.
Thank you, Dominic. Hello, everyone. Bonjour à tous. COVID-19 and its threat to our public health and our economy has caused governments around the world and in Canada to take extraordinary measures to protect their citizens. Our government has made a solemn commitment to Canadians to be prudent and focus on doing the right thing, guided by science and expert advice. Our approach to protecting Canadians has worked. Canada has one of the highest vaccination rates in the world, with one of the lowest death rates in the world, and is also experiencing one of the fastest economic recoveries. We've seen how our measures have slowed down several COVID peaks and has given our healthcare system early warnings to adjust and respond. As the COVID situation evolves and as we learn more about this virus, we have been adjusting our measures. Many of these measures have been lifted. And it's clear that the COVID situation is not the same now as it was last fall when we implemented the vaccine mandate for travelers and transport workers. La situation de la COVID-19 a évolué depuis l'automne dernier.
Since last fall.
And this is thanks to the millions of Canadians who rolled up their sleeves and got vaccinated. That's why today's announcement is possible. And I'm pleased to announce that on June 20th, our government will suspend the requirement to be vaccinated in order to board a plane or train in Canada. Le 20 juin, notre gouvernement suspendra l'obligation de se faire vacciner pour monter à bord d'un avion ou d'un train au Canada. Employers in the federally regulated transportation sector will also no longer need to have vaccination requirement for their employees. The suspension of the vaccine mandate was informed by key indicators, including the epidemiological situation and modeling, vaccine science, and high levels of vaccination against COVID-19 in Canada. As for travelers coming to Canada by air, land, and marine, there are no changes. Il n'y a pas de changement pour les voyageurs qui entrent au Canada. All travelers entering Canada must continue to follow all entry requirements, including vaccination and using ArriveCan. As for cruise ships, vaccination for passengers and crew will remain in place. This decision is based on the unique nature of cruise ship travel, including the fact that passengers are in close contact with each other for an extended periods of time. Also, travelers on federally regulated planes and trains still need to wear a mask. Les voyageurs doivent continuer de porter un masque dans les avions et le train. Masks are an effective way of reducing transmission, especially in areas with restricted space, such as onboard planes, trains, or cruise ships. Our government will always continue to evaluate measures and will not hesitate to make additional adjustments based on the latest public health advice and science. It's also important to note that while travelers will be able to board a plane without having to verify their vaccination status, international travelers need to verify public health requirements imposed by the country they want to visit. Many countries around the world, including the US, continue to require a proof of vaccination upon entering their country. I want to thank all the travelers who've been vaccinated to protect themselves and others, as well as the transport workers who are working tirelessly to ensure the recovery of the sector. Thank you, everyone. Merci. And now I'd like to give the floor to Minister Fortier.
Thank you. Merci, Ministre Alghabra. J'aimerais tout d'abord commencer par reconnaître que je vous adresse depuis mon salon ici à Ottawa-Vanier sur le territoire traditionnel non cédé de la nation algonquine-Anishinaabe. La vaccination a été et demeure le moyen le plus efficace de prévenir les maladies graves causées par la COVID-19. Et dès le début de la pandémie, nous nous sommes engagés auprès des Canadiennes et des Canadiens à protéger leur santé et leur sécurité. Nous avons mis en place des mesures pour protéger les travailleurs et nos communautés. Et c'est pourquoi, en octobre dernier, le gouvernement a mis en œuvre la politique de vaccination contre la COVID-19 pour l'administration publique centrale, y compris la GRC. As the employer of the federal public service, the government has a responsibility to ensure public service servants can work safely. And the policy has done what it was meant to do. It helped make federal work sites, as well as the communities where public servants live and work, safer. And it provided a safer environment for Canadians accessing government services in person, including for more vulnerable members of our communities. Public servants understand the importance of keeping themselves and others safe. which is why close to 99% of them stepped up and got vaccinated. Public service first servants were not alone in rolling up their sleeves. D'un bout à l'autre du pays, les Canadiennes et les Canadiens ont fait leur part. Ils ont pris les devants pour se protéger et protéger les personnes qui les entourent. Et maintenant, les taux d'hospitalisation et les cas de maladies graves causés par la COVID-19 sont en baisse dans tout le pays. Aujourd'hui, avec des taux d'immunité en hausse et un taux de vaccination parmi les plus élevés au monde, la situation de la santé publique au Canada s'est nettement améliorée. Et c'est pourquoi le gouvernement suspend l'obligation de vaccination pour les fonctionnaires à compter du 20 juin 2022. As of that date, employees of the core public administration, including the RCMP, will no longer be required to be vaccinated against COVID-19 as a condition of employment. Employees who are on administrative leave without pay as a result of the vaccination policy will be contacted by their managers to resume regular duties with pay, and the bargaining agents have been informed. Similarly, we expect other vaccine requirements put in place for employees of separate agencies, Crown corporations, governor and council appointments, and contractors to also be suspended. And I want to reiterate that vaccines continue to provide strong protection against serious illness. All Canadians should keep their vaccinations up to date to keep that protection as high as possible. Et en conclusion, la politique du gouvernement du Canada en matière de vaccination a contribué à faire en sorte que les fonctionnaires puissent travailler dans un environnement sain et sécuritaire, que ce soit dans un bureau, un centre de service, à la frontière ou à la maison. La situation a évolué, tout comme notre réponse, et la suspension de la politique reflète le fait que nous avons pris des mesures responsables pour gérer la pandémie et par conséquent, nous nous trouvons maintenant dans une bien meilleure situation. Mais soyons clairs, la pandémie n'est pas encore terminée. Vigilance remains essential to protect not only our own health, but our healthcare system and our economy. Again, this means keeping up to date with our vaccinations, and it also means being ready to adjust our approach. Et permettez-moi de réitérer ce que je viens de dire en français. La vigilance demeure essentielle pour protéger non seulement notre propre santé, mais aussi notre système de santé et notre économie. Et encore une fois, cela signifie que nous devons mettre à jour nos vaccinations et être prêts à adapter notre approche. The government will continue to closely monitor domestic and international scientific evidence to assess the need for appropriate public health measures, including a reintroduction of vaccine mandates if necessary. Et comme nous le faisons depuis le début, nous continuerons à protéger les Canadiennes, les Canadiens et le Canada. C'est notre engagement et notre plus grande priorité. Thank you, merci. Et je cède maintenant la parole au ministre Duclos.
Merci, Mona, et bonjour à tous et à toutes. J'ai le plaisir, moi aussi, d'être accompagné aujourd'hui par mes collègues ministres, le ministre Leblanc, le ministre Algabra et la ministre Fortier, bien que virtuellement, pour cette importante annonce. I would like to begin by recognizing the enormous strides we have made since the beginning of this pandemic. Our government's response has always been informed by evolving science, research, prudence, and expert public health advice to help make decisions that serve to protect people everywhere in Canada. Following a successful vaccination campaign supported by proactive vaccine procurements and collaboration at all levels of government, 32 million eligible people in Canada have now received a primary series of vaccination against COVID-19. La science est en constante évolution et chaque jour, nous en apprenons plus sur le virus. Et la science est claire. La vaccination demeure l'un des moyens les plus efficaces de protéger nos familles et nos communautés et de nous protéger nous-mêmes contre la COVID-19. Nous savons maintenant aussi que la vaccination peut contribuer à réduire le risque de développer ce qu'on appelle le syndrome post-COVID-19, aussi appelé la COVID longue en cas d'infection. Si la vaccination demeure essentielle, Le variant Omicron nous a toutefois démontré que 2 doses ne suffisent plus, car avec le temps, l'immunité acquise grâce au vaccin 2 doses actuelles s'amenuise. Dans ce contexte, il est donc essentiel que nous comprenions tous et toutes l'importance de suivre les recommandations des autorités de santé publique de mettre à jour notre statut vaccinal. En clair, cela veut dire que si vous êtes admissible à une 3e ou même une 4e dose en vertu des recommandations des autorités de santé publique, vous devriez la recevoir dès que possible. Il s'agit de la meilleure façon d'éviter de développer une forme grave de la maladie, d'être hospitalisé ou d'en mourir, et une très bonne façon aussi de réduire les infections et la transmission. Il s'agit aussi de la meilleure façon de protéger nos travailleurs de la santé qui sont sous un énorme fardeau et de protéger aussi les plus vulnérables parmi nous. Though vaccination remains absolutely essential, the Omicron variant has shown us that 2 doses are no longer enough because the immunity acquired through 2 doses varies and wanes over time. In this context, it is therefore essential that all Canadians understand the importance of following the recommendations of public health authorities and stay up to date with their vaccination. In simple terms, this means that if you are eligible for a 3rd or even a 4th dose under the recommendations of public health officials, you should receive it as soon as possible. This is the best way to avoid developing a serious form of COVID-19, being hospitalized or dying from it. It's also the best way to reduce the spread of COVID-19 and the incidence of long COVID. It's also the best way to protect our healthcare workers and the most vulnerable among us. As mentioned by my colleagues, after reviewing the latest scientific evidence involving COVID-19 epidemiology globally and in Canada, vaccination coverage rates, and listening to the advice of public health officials and experts, we have decided to suspend mandatory vaccination for domestic travelers, transportation workers, and federal employees. The context has changed in that we now benefit from better levels of immunity from both vaccination and infection, the wider availability of antiviral drugs, and lower and decreasing hospitalization rates. Canada is now better equipped to effectively manage the COVID-19 pandemic and reduce pressure on our healthcare workers. As I have said, because of the immense value of maintaining individual and collective immunity, both in terms of protecting our healthcare system and our economy, the Government of Canada recommends that everyone in Canada continue to protect themselves and their loved ones by staying up to date with COVID-19 vaccines, which includes a 3rd dose for all adults. While the suspension of vaccine mandates reflects an improved public health situation in Canada, the COVID-19 virus continues to evolve rapidly and circulate in Canada and globally. Given this context, current vaccination requirements and other measures at the border entry will remain in effect to reduce the potential impact of international travel on our healthcare system and workers, and track the potential introduction of new variants of concern. As the COVID-19 situation evolves and as our country prepares itself for whatever may come our way later and in the fall, we will continue to evaluate new evidence to determine the best way to reduce the burden of COVID-19 in our communities and protect our healthcare workers and patients. Avant de conclure, j'aimerais rappeler à tous et à toutes que la COVID-19 est toujours une réalité parmi nous. Le gouvernement du Canada continuera de travailler en étroite collaboration avec toutes les provinces et tous les territoires pour faire en sorte que toutes les personnes admissibles puissent recevoir leur dose de rappel et être ainsi à jour dans leur vaccination. Again, let me be very clear. Vaccination, combined with individual public health measures, continues to be the best way to protect ourselves, our loved ones, and our economy as we return to the activities and social interactions we have so dearly missed over the past 2 years. Merci. Thank you.